Hello and welcome to Caregivers First, the show brought to you by SCAN, Social Community Activities Network, a nonprofit agency dedicated to helping active adults stay informed, empowered, and inspired. I'm Lavelle Jones, your host. We have a great show for you today, so let's get started. The more we know about the medications we take ourselves or give to our loved ones, the better we can manage our health care and contribute to positive outcomes. Today's show is all about managing medications and prescriptions. For today's conversation, we're so fortunate to have as our guest Jaclyn Palummo. Jaclyn is a clinical assistant professor at Fairleigh Dickinson University and clinical pharmacist specialist at Hackensack Meridian Health Ocean Medical Center. She specializes in internal medicine and critical care at Ocean Medical Center, where she also teaches pharmacy students and collaborates with physicians and other healthcare professionals to deliver the best possible patient-centered care. Welcome, Jaclyn.
Thank you. Thank you for having me.
Thank you so much for joining us today. You know, I'd like to start our conversation with a general question. The terms medication and prescription are very often used interchangeably. Would you explain to us the difference between medication and prescriptions?
Sure. So I would say medications are the overarching category, and then prescriptions kind of fall under that. So you have your prescriptions are your medications that you would pick up from the back of the pharmacy. So the pharmacist is going to fill that prescription.
I see.
The doctor prescribes it. You go away with that piece of paper, right? And then you bring it to the pharmacy. They get it filled, so they run it through your insurance, and then you pick it up. On the other hand, you have over-the-counter medications, which you can just walk into any pharmacy and pick out whatever you would like from the front of the pharmacy, and that would be what we call over-the-counter medications.
I see. Okay, thank you for clearing that up. Why is it important for caregivers to understand what medications are for?
So that is extremely important to understand what medications are used for. It's important to know what side effects to look out for as well. So knowing what medications you're taking for which disease state is important. So for example, let's say you are using insulin for diabetes.
Okay.
So insulin is commonly used in various ways. Sometimes it's once a day, sometimes it's 3 times a day with your meals. And so it's important to know if you don't eat and you don't have that mealtime insulin, that maybe you shouldn't give that insulin, and to look out for the side effects of, say, low blood sugars, which we call hypoglycemia. So you should always be aware of the side effects that could potentially happen for that specific medication, and to have a plan in place for what to do in case that side effect does occur. So look out for the dizziness and the sweating and the weakness that might be associated with those low blood sugars.
I see.
And having maybe orange juice on hand, to combat that low blood sugar.
Oh. Let me ask you a question. It's important for caregivers to know what the medications are for. Does that apply to when a patient is in the hospital as well as when they're out of the hospital?
Sure, yes. It is important because we want that continuity of care. So if they were on a medication at home, we want to make sure, if it's appropriate, that we're continuing that medication once they are admitted to the hospital.
Mm-hmm.
And then, of course, once they get discharged, that we are continuing that medication once they get home.
Okay, terrific. Thank you. You mentioned earlier over-the-counter medications.
Yes.
You can go in any drugstore and there are medications for stomach aches and headaches and muscle aches and you name it. We love self-medicating, but is it important for us to let our primary care physicians know if we're taking over-the-counter drugs?
It is. It's very important, especially if you find yourself taking some of those over-the-counter medications often. So if you're taking a lot of Tylenol for pain or a lot of ibuprofen for pain, it's very important to let your doctor know because they might have a better recommendation for you. And you also want to let them know, and also let your pharmacist know, because there could potentially be drug interactions with the medications that you're taking that are prescriptions. So behind the scenes, when a pharmacist is filling your prescription, the computer does this very intelligent thing where it runs a drug interaction check. So everything that you get filled at that pharmacy gets run through this check to make sure we don't have drug interactions. If you're taking things over the counter, you're losing that safety check, right? Because those medications aren't getting run through.
Okay.
So it's always a good idea to let your doctor know or your pharmacist know, or even just ask, hey, is it okay that I take this? You know, my stomach is upset. Are there any, anything I should look out for or be aware of, with my current medications? Is it okay for me to take this?
Staying on the topic of over-the-counter drugs for a second, I have had friends say to me, well, it's an over-the-counter drug, so there's no risk. There's nothing that can happen. Are there risks associated with over-the-counter drugs?
So there are, especially if you don't stick to the recommended dosage on the label. So it's very important to read the labels on those over-the-counter medications.
Okay.
For the most part, things are safe. But you always want to have that double check. It's, the pharmacist is there at the pharmacy for your reference. So you can people always think, oh, I didn't pick up prescriptions, so I'm not, I don't have to talk to the pharmacist. But they are there, they are experts, right, on all medications. So you can absolutely go and ask them, for advice on, what to take or how much to take of something.
You lead me to my next question, and that is, when we do go to the pharmacy, what are the types of questions that we should be asking of our pharmacist?
Sure. So, off the bat, you should be asking, what is the best way for me to be taking this medication? Okay. You can ask them the best storage options for your medications. Some meds have to be, stored in the pharmacy, so that's always, a good question to ask. What happens if you miss a dose? Should you take 2? Or maybe you should skip it, and maybe it's not a big deal if you miss a dose of something. So those are all really great questions to be asking your pharmacist when you're picking up medications.
So you mentioned storing medications. So I'm going to assume that depending on what it is, it has to be, are we talking refrigeration or keeping it out of the sun?
Sure.
What do we mean?
So ideally, if you're I would say most, tablets and capsules, things like that, should be stored in a cool, dry place. Of course, you want to keep it away from children, away from pets, anybody who may be able to get to it that shouldn't. Some specific medications, like we talked about insulin before, should be kept in the refrigerator. So when you do go pick up those medications, it's important for you to ask those questions, or the pharmacist might come out and just, tell you, especially if it's a new medication.
Yes, okay. Many of us, I'm saying us because it includes me, take multiple medications on a daily or weekly basis. What tips can you give us to help us manage those multiple medications?
Sure. So I love a pill box. I think that if you're familiar with a pill box, it has Saturday through Sunday, and each day and time has its own little square. So you can organize your medications by morning, afternoon, bedtime, and it keeps you very much on track with the time and what day you should be taking your medications. Most pharmacies have, you can purchase them. Some of them are very convenient, where you could kind of take off a whole day, put it in your purse, and then walk away with it, and then, put it back in when you're done after.
Okay, all right, terrific. Some people have their prescriptions filled at more than one pharmacy. Oftentimes we do that for price issues, but is there any risk or downside to having prescriptions filled at different pharmacies?
Sure. So having prescriptions filled at different pharmacies, like you said, a lot of people do it because of cost. You know, it might be cheaper at this pharmacy for this medication, and then at this one it might be, you know, cheaper for another medication. There are risks because, like we talked about before, that interaction check isn't happening. Unfortunately, different pharmacy computer systems don't talk to each other. So if you do happen to find yourself going to multiple pharmacies, you might want to just let them know, hey, I'm on this certain medication, or this is my med list, my total med list. And then they might be able to make a note and say, you know, this patient is on, you know, warfarin, which has a lot of drug interactions. So, you know, it's just something, an extra check for their eyes if they do get a new prescription for a new medication.
I'm surprised that different pharmacies don't use a sort of central database where they can always know what a patient's medication history is.
Sure. So the let's say the chain pharmacies, you know, of course, like say CVS will talk to CVS in the computer, but CVS system won't talk to Walgreens.
I see.
So that's usually where you see the price differences are between some of those chain pharmacies.
Oh, okay. That's news for me. Thank you for sharing that. I want to talk a little bit about technology.
Sure.
Many of us are not what I say are tech savvy, but I understand that there may be some advantages that technology provides to help us manage our medications and prescriptions. Can you talk a little bit about that?
Sure. So our cell phones are addictive, right? Everybody, you know, is constantly checking their cell phones, but they can be useful when it comes to managing your medications. So, for example, I no longer have an alarm clock, but I use my phone. So if it's, let's say, time to take a medication, you can just set a little alarm in your phone saying, you know, take this with breakfast, and it's a reminder for you to take your medication when you take your breakfast. And you can do that for your lunchtime, you know, medications, your bedtime medications, just to set your reminders to make sure that you are, you know, taking those medications.
So using the smartphone, I guess, to help with that.
Sure.
And how about can we use the smartphone to keep a record of medications? Is that something that we can do?
Yes. So smartphones, especially nowadays, I know Samsung and the iPhone actually come preloaded with these health apps. So some of us, you know, it comes loaded with all these apps and you don't use half of them, right?
Yes.
So you kind of overlook it until you're actually looking for it. So personally, I have an iPhone, so I know in the health app you can load in any of your most recent labs, you know, your most recent blood pressure, your past medical history, any surgeries that you've had. You can actually input all of that information into that app. So when you do go to the doctors, you're not, you know, shuffling for a piece of paper. Or if you do happen to go to the hospital, you know, you or your caregiver can pull up that app and you'll have your full updated history right there on your phone.
That's a great tip because I'm thinking in those situations where perhaps the caregiver needs to quickly access, let's say your medications, if they have access to that information via the smartphone, I can see where that would be very helpful. And yeah, okay, excellent,
Yes.
Wonderful. Well, we are going to take a break from Caregivers First right now, but we'll be right back, so please stay with us.
You probably already know that rehabilitation is a must for successful recovery from surgery, injury, or serious illness. What you may not know is that you're free to choose where you go for rehab. In Monmouth and Ocean County, the compelling choice is Care One. Where you choose to go for rehab matters, and with Care One, you have 4 convenient locations to choose from in Monmouth and Ocean counties. Care One at Jackson, Care One at Wall, Care One at Homedale, and Care One at King James in the Atlantic Highlands. At Care One, you'll work with a team of experts to develop a plan based on your needs and goals. You'll have the full support of caring, compassionate physicians, RNs, licensed therapists, and nutritionists dedicated to helping you recover successfully, without setbacks, at a pace that makes you comfortable and successful in meeting your rehabilitation goals. Once you take the first step with us, you'll never look back. Call 877-99-CARE-1 today and come for a tour.
Welcome back to the second half of our show. We're talking to Jaclyn Palummo. Jaclyn, I want to ask you a question about emergencies as it pertains to our medications and prescriptions. How can we best plan and prepare for emergencies?
Sure. If an emergency does seem to rise, it's important to be prepared with regards to medications. So every once in a while, someone comes into the hospital and we ask for their med list and they don't know. You know, if you do have a pill box, maybe you're not familiar with what's in it. Someone else fills it for you and you just kind of take as the time and days go by. So it's very, very important to keep an updated med list of exactly what you're taking. So the name of the drug, the dose, and the frequency are very important because we would love to continue that medication as appropriate. Whatever you were taking at home, we would want to continue it in the hospital. And going back to technology, so we might have a piece of paper with an updated med list, but you could also have that list electronically, stored in a cell phone or an iPad or in the cloud somewhere.
I see.
So that it's, like I said, right at your fingertips.
So it's important to prepare for emergencies to have a list of all of your current medications.
Yes.
Okay, and I guess to make sure that it's accessible, perhaps not just by you, but by someone who may be assisting you in an emergency.
Yes, so someone who knows your cell phone password, or who can get in if you do choose to store it, or maybe they know where you store your med list. And then another thing that's important is to maybe on that list have who your primary care doctor is, or what pharmacy you do go to, because if we don't have the most up-to-date list, at least we can call that pharmacy and ask them for an updated medication list.
I see. Okay, very important information. Thank you. Mm-hmm. You mentioned something in the first segment that I want to come back to, and that is perhaps skipping medications. I will admit that I am guilty of having done that in the past. And I guess my question is, let's say someone goes on a long weekend, let's say 3 or 4 days, and once they get there, they realize that, oh, I didn't bring my medications. Should that person run out and try to find a local pharmacy and get the prescriptions filled, or 4 days, they can just wait until they get back home? What is your best advice on that situation?
So it very much depends on what medication or what medications you're talking about. So it's very dependent on, if it's your insulin, of course, that's something that's important that you take every day. So my advice for something like that would be, maybe go to the pharmacy, especially if you do go to one of those chain pharmacies. Those, a CVS here might talk to a CVS there, and they'll be able to pull up your med list and hopefully be able to help you out and fill it for you. So I think it's very much dependent on what medications you're talking about. Ideally, of course, we would want you to continue your medications as appropriate. Something like a multivitamin maybe isn't as big of a deal as something like, say, for your blood pressure or, for your anticoagulation or something like that. Mm-hmm.
Okay, excellent. Thank you. I'm going to ask you a question, and it may sound so simple, but I'd love to have the answer. Why are there expiration dates on our prescription medications? And if we take them beyond the expiration date, are we putting our health at risk?
Sure. So expiration dates are, set by the manufacturers. Again, it very much depends on the medication that you're taking. If there's, let's talk about your food. If there was an expiration date on your food, would you want to eat it?
Probably not.
Right.
Depends on what it is, yes.
So would it be harmful for you? Likely not. But you want to try to adhere to those expiration dates. I'm sure if you were to go in your medicine cabinet in your bathroom and dig really deep, you'll find something from, say, 10 years ago that's been in there. That I would definitely get rid of and try to update your medication cabinet.
It's interesting you mentioned the medicine cabinet. I think that aspirin, for me and for my family, it's amazing how, every 6 months or so you can go into the medicine cabinet and there are bottles of aspirin and they have expiration dates on them. So to your point, I guess it depends on how long they've been expired, but as a general rule, you just shouldn't take any medication beyond the expiration date.
I would say yes. In general, I would just put it aside and dispose of it in the best way possible, and just try to update your cabinet.
Okay. Let me ask you a question about some of the riskier practices I think that some of us fall into for one reason or another. One is when two people, let's say they're friends, they have the same condition, so they share medication. I'm sure that's not a good idea, but walk us through just how bad an idea that is and why.
Sure, that is definitely not recommended. And it's hurts my ears actually to hear you say that. Unfortunately, people do share their medications, and I think that it's important not to do so because let's say, for example, one of you does end up, say, in the hospital, and there's no record of you taking that medication. So we do our normal check. We call the pharmacy and say, what medications, we need an updated med list, and the pharmacy says, oh, they're not on anything. So, the patient, let's say, can't tell us the name of the medication. Maybe they forgot or maybe they're unsure, but they know it's for blood pressure. So if the patient doesn't know, the pharmacy doesn't know, it's very difficult for us on the hospital end to be able to discern what exactly they're taking. And of course the doctor wouldn't know because they didn't prescribe it. So let's say you do end up in the hospital, then we don't know if maybe you're here because you're having an adverse effect or an allergic reaction to that medication, because we can't figure out exactly what medication it is that you're taking. So it's important, if you do have one of those chronic medical conditions, to go see your doctor and get a official workup and diagnosis and prescription from them, just to keep your records the most up to date.
Okay. And something that you just mentioned, I think is important to note, and that is particularly for chronic illnesses, you may be on a prescription for a long period of time. How important is it to get regular checkups with the physician to make sure that those medications are still the right ones and are working?
Sure. So I think that also very much depends on the disease state and the medication. It's up to the doctor to determine, what the next time is that they want to see you. So for your blood pressure, for example, they might start you on a new medication and they might actually tell you to check your blood pressure at home. Or they might say, go to your local pharmacy and have the pharmacist, check your blood pressure.
Yes.
And this is your goal, and we want to make sure that you're in goal. And if not, give me a call. So especially when they're starting new medications, they want to make sure that they are working properly. So they might monitor you a little bit more. And then as the longer you're, say, stable on that medication, then they aren't as worried about checking up.
I see. Okay, terrific. I would like to have you talk a little bit about something that you are focused on in your career, and that is patient-centered care. Talk to us a little bit about what that means.
Sure. So patient-centered care is really working as what we call an interdisciplinary team. So having your pharmacist work very closely with the patient and with their caregiver, as well as their physician, to really find the best medication regimen for that patient. Let's say if you're someone who frequently forgets to take their medication, and we have you on a drug that you're taking 3 times a day. The idea of patient-centered care is having that conversation with the patient, the caregiver, and the physician and saying, well, we have a long-acting medication that would be equivalent to what you're taking now, and maybe we could switch it to that and you can take it once a day instead of having to take it 3 times a day. So as pharmacists, we have that knowledge of the different formulations and the different types of medications that are out there. So as we talk to the patient, especially in the community pharmacy, you might have a patient that comes in complaining, I don't think this is working for me, I still have pain. The pharmacist is like the liaison kind of between the patient and the physician, and they can call the doctor and say, hey, they don't think this is working, but we do have this that's similar but maybe a little bit stronger, and they might make that recommendation and be able to switch the patient to something that works better for them. Sometimes when patients go to the doctor's office, they're so worked up about their visit that they forget about asking those questions that they wanted to ask before they went to the office. And sometimes when they're in the pharmacy and they're talking to the pharmacist, those questions come out, and the pharmacist can really be there to have that conversation with the physician.
That's very enlightening. I must say that it didn't occur to me that there could be that very fundamental liaison role that the pharmacist can play between the physician and the patient. So is patient-centered care a new concept, or is it, are we seeing more of that in the medical field today than we did, say, 10 or 15 years ago?
I would say it's the idea of patient-centered care and working as a collaborative healthcare team is, has been in the works for some years now, but it's becoming more popular the more the pharmacist's role is expanding. So now sometimes you might see a pharmacist actually sitting in a doctor's office and almost seeing patients on their own, especially for those chronic disease states like diabetes and high blood pressure. The pharmacist can actually sit there with the patient and find the best regimen for them right there on the spot with the physician and with the patient.
Okay.
So that's becoming more and more popular, and I think that it really benefits the patient when you have that interdisciplinary team.
Of course. And would you recommend that we as patients perhaps ask for that when we talk to our physicians, or perhaps when we're in the hospital that, ask if it's appropriate for the pharmacist to be involved in the discussions?
Sure, absolutely. I think it's appropriate, and a lot of hospitals, I know, for example, the hospital I work at, when you get discharged from the hospital, you actually are seen by a pharmacist before you leave. And any new medications that you're leaving, you'll actually sit with a pharmacist in your room and have a conversation, about, and they'll counsel you and tell you how to properly take it and some side effects to look out for before you even step foot out the door. So
Wow.
it's best practice
Great.
now to have a pharmacist part of that team.
Terrific. Thank you so much. I have learned so much in this session, and unfortunately, we are going to have to stop here. But again, thank you so much for being with us, and I do hope that you'll come back in the future. This
Absolutely.
has been very informative. Thank you, Jaclyn.
Sure. Thank you.
And thanks to all of our viewers for spending time with us. I hope you found the information useful. If you did, please share it with your family, friends, and neighbors. It's been my privilege to be your host today. I do hope you'll join us for the next edition of Caregivers First. Until then, take care.